But I'd like to ask one other thing that I see there is a question about, and that is, I'm interested, certainly at Memorial Sloan Kettering and a few other places, they're doing studies of the role of liquid biopsies potentially to identify, to track disease response and anticipate acquired resistance. So maybe Pasi first, if you can speak, and if others have comments on what you see as the emerging or future role of liquid biopsies, not just as an initial diagnostic, but as a serial tool.
I think, sorry, Pasi, go ahead.
Go ahead. No, I think sort of take that in two categories, sort of the disappearance of detectable cfDNA, and I think we see several studies whereby in individuals where the cfDNA disappears at the onset of a therapy versus where it doesn't, that predicts for a better outcome. So I think that is that has been established in a number of studies. What to do with that information at the moment, I think, is less clear, and I think still in the area of investigation. In terms of the resistance mechanism, you can, of course, detect resistance mechanisms sometimes before actual clinical resistance happens. Now, most of the time, this happens usually 1 to 2 months prior to clinical resistance. It doesn't happen 10 months or a year before clinical resistance. And I think that helps, as Jack framed it, anticipate what to do next. I think do you change someone's therapy when you see that and they're clinically doing well? I think at least my own viewpoint on that is that you change therapy when the patient needs it, not based necessarily on a test, but I think it helps you anticipate what potentially to do next.
I think that's very important because that's the future of oncology. If you think about now how we assess response now is very empirical. You know, every 2 or 3 months we empirically send the patient for a CAT scan and we're trying to see what's going on. But it makes more sense to be first of all doing something more rational, like be testing if the DNA or RNA in the blood are changing for resistance or for benefit of the patient. The problem is that the limitation in technology that we have, because we know about DNA for more than 40 years and we still don't have an accurate way to track. But I think for the future, that's what needs to be done.